Okay, let's go over the impressions of Ziba's workup and then talk about a treatment plan. So I'll go through these paragraph by paragraph. All right. Number one, starting here. Ziba appears to have symptoms of metabolic dysfunction due to being underweight, low BMI. These patterns may impact her immune function, vascular tone, thermoregulation, and her ability to stabilize blood sugar levels. So there's a metabolic profile that happens when people are underweight and frail, and she has both lack of body fat and lack of muscle mass. So remember that body fat and muscle mass have metabolic activity. So body fat is going to release adipocytes and adipokines and have a very powerful impact on thermoregulation, appetite, immune modulation, and then muscles are going to release myokines, and myokines are going to have a significant impact on all the same things: immune function, neurological function, metabolic activity. So when someone's body mass index is really small and they're underweight, they end up with all the symptoms that, to some degree, what she has, like loss of immune function, loss of immune resiliency, thermoregulation issues, inability to stabilize blood sugar levels. So myokines, adiponectin, adipokines, leptin itself all play a role here. So, the first thing, the big impression of what's happening here is that she has low BMI. If you see someone who's like really obese, you expect them to be inflamed and have hyperlipidemia and hypertension and the whole metabolic syndrome cascade. When you see someone who's significantly underweight and has lack of muscle mass and lack of body fat, you're concerned about this presentation. This is the presentation of a low BMI person. Now, being 69 and being frail is a serious risk factor, and being underweight when you're older, past 60, does increase the risk for all-cause mortality. So it's a really big issue. So not only is it important for her physiological change to reduce a lot of her symptoms, but it's also important for her to improve her longevity. Previous laboratory tests conducted 7/6/2021 identified patterns associated with impaired thyroid conversion, and her TSH was slightly elevated at 4.77. These findings, in addition to symptoms of hypothyroidism, suggest there may be a dysfunction in thyroid metabolic pathways. Further testing will need to be conducted. So there's some kind of weird things happening with her thyroid, borderline hypothyroidism and conversion. We just need to see what's happening more. Obviously, those can have a major impact on thermoregulation and metabolic rate and energy and so forth. During the examination, expiratory wheezing was noted with pulmonary auscultation. SpO2 measurements were 96%, and spirometric evaluation identified mild pulmonary obstruction of 40%. There's a history of asthma that may play a role in general immune activation. Evaluation of environmental allergens will need to be conducted with IgE testing. So this is the advantage of doing the physical exam. So 96% concentration of oxygen in tissues is going to really impact her energy, her mood, her overall well-being. So this is a big deal. It's not a serious disease where we need to worry about urgent care, but from a functional perspective, we don't want someone that has 96% saturation of oxygen. We want 98%, even 100%. And she's got clear pulmonary obstruction and wheezing, so we're going to have to see what's happening with her airborne allergens and do some testing there. During the examination, there's also a temperature discrepancy between the right and left upper limbs of 4 degrees. So right and left, that's some severe metabolic imbalances. Usually, it could just be less, but when it's between left and right, that's a significant disruption in normal metabolism. Additionally, a 13% difference between proximal and distal tissues on the upper extremity, and 11% difference between proximal and distal tissues on the lower extremity. This is just really poor circulation. The perfusion index was low at 0.88. These findings, in combination with borderline normal ankle brachial index symptoms of vascular aberrancies, suggest possibly systemic arterial disease. So we want to see if she's got any kind of calcifications. A coronary artery calcium scan should be conducted to rule out underlying pathophysiology and the risk of cardiovascular disease. And just at her age group, 69, we really want to see if those things are abnormal. Ziba's medical history suggests the possibility of autoimmune disease involving joint autoimmunity, intestinal autoimmunity, and thyroid autoimmunity. Evaluation of autoimmune target proteins with SAXRA5, cyclic citrullinated peptide, CCP antibodies, and systemic lupus dermatosis profile will need to be conducted. So we want to look for systemic and joint autoimmunity as well as tissue-specific autoimmunity with SAXRA5. There's also a strong possibility she may suffer from small intestinal bacterial overgrowth, SIBO, due to her symptoms and positive response to FATMAP diet. Further evaluation will need to be conducted. So those are the main things we really want to look at with her. The big thing here is her underweight, metabolic profile, any hypothyroidism issues, figure out what's going on with her asthma and any triggers there. Something fishy about her circulation. She may have some early cardiovascular disease, and she may have some autoimmunity. Definitely has some patterns of SIBO with her clinical presentation. So my laboratory recommendations are just some routine blood work and see what's happening here. So chemistry 14, CBC, lipid panel, 25-hydroxy-D, C-reactive protein, homocysteine fibrinogen, and a thyroid panel and HbA1c. The thyroid panel also to include reverse T3, TSH, T4, T3, T3 uptake, free T4, free T3. So I want to see what's happening. SLE profile, CCP, this is just look for systemic autoimmunity and joint-related autoimmune diseases. Total immunoglobulins, make sure immune system is fit before we get into Cyrus-Ray-5. And then serum allergen profile, we're going to use Southern California because that's the region she's in. That can explain some of her asthma patterns. And then just with the routine blood tests, it's only a few dollars to add your analysis, so I always do that. Want to make sure she gets a coronary artery calcium scan, just because of her age and some of these weird vascular issues and her borderline ankle-brachial index patterns. This will be one of the most important things, increase caloric intake to increase body weight. Then no nutritional recommendations at this time because we're trying to figure out what the pathophysiology is, and ultimately she doesn't have a micronutrient issue. Is the key thing. She has a macronutrient issue. She's underweight. So we want to see if we can improve that. So goals of clinical management. Phase 1, increase body weight to normal BMI, stabilize blood sugar levels, determinative symptoms of thermoregulation sensitivities, and overall wellness improve with improved body weight. That's the first thing we want to do. And then as the labs come back, develop any strategies for autoimmunity if labs are positive, develop any strategies for thyroid metabolism obviously if labs are abnormal, and then number 3, further evaluate the possibility of small intestinal bacterial overgrowth. So that is the strategy. Phase 1, let's just see when we can get her muscle mass and her body fat improved. And that could take some time before that changes, but even a few pounds here and there could make a huge impact in her physiology and pathophysiology and improve her all-cause mortality because she's underweight. She's definitely not getting enough protein in her diet. Hopefully as she increases her protein in her diet and even fat in her diet, we can see some change there. So that's the strategy, and we'll have to see where it goes from here.